In Eldoret, we understand that the National Assembly's Committee on Health is visiting the Moi Teaching and Referral Hospital, where you remember that yesterday in the news we heard of that threat that nurses that are working in the Ministry of Health, understandably those working with the level 6 hospitals, for instance, Moi Teaching and Referral and KNH, Kenyatta National Hospital, might be joining the strike. We don't know what the situation is. Good morning, Wanyama. What is it like with the Moi Teaching and Referral Hospital, even as you tell us the agenda of the National Assembly? Are the nurses at work? Is there a threat that they might be downing their tools anytime soon?
A very good morning to you back there in the studio, Sam. And in Moi Teaching and Referral Hospital, as you said, where I managed to talk to the CEO, Dr. Arwasa, and he said that Moi Teaching and Referral Hospital, they already signed that return to work formula. And they are saying there is nothing, or there is no such a thing that is going on, like nurses will be going back on strike, this as it has been alleged earlier in news. So he's saying all is said, all is well, and there is no strike at Moi Teaching and Referral Hospital. And as you said, Uasin Gishu County is not on strike, but our neighboring county, that is Elgeyo Marakwet, that is the county that is on strike so far. But as you said earlier, Sam, is that we Parliamentary Committee on Health are here, and I'm now joined by the chair lady here. Maybe, Mheshimiwa, what are you doing here in Uasin Gishu? Why have you decided to visit Uasin Gishu? What are the major issues?
Our main concern today, we are coming to Moi Teaching and Referral Hospital, which is part of the national hospitals that are managed by the national government. You appreciate that health is devolved, and so we only have 4 facilities that are under national government. And from last year, my committee visited Mathari Hospital, we visited the Spinal Injury Hospital. We did a report, and we're also preparing ourselves for the budget. So we're here to visit Moi Teaching Referral, and by next week we finish with Kenyatta. Basically, our aim is to meet the board, meet the staff members, acquaint ourselves with how the management is being done, the challenges they are facing, so that as we do the budget, we noticed last year that the budget we did mainly focused on things that are not really issues that are affecting the facilities that are under the national government. And so we said before we focus on the counties, before we feed the other child, we need to know why our child is suffering. And so we will be putting more emphasis on the budget on those 4 facilities to make sure that they are well equipped, that they are, the staff members are adequate, even if not enough. And so today we will be visiting and seeing how Moi Teaching Referral Hospital is doing. It has been one of the facilities that has been doing very well. And so if there are lessons we would learn here to be implemented in Kenyatta National Hospital, why not? At the same time, we'll also visit the governor of this county. Basically, there have been an issue of the strikes, and we really need to understand what the counties are suffering from. Though we have a parallel health committee in the Senate that is fully dealing with the nurses' strike in Kenya, because all the county facilities are under the Senate. But we would want to learn a little bit from even the governor here, how he has managed to work about the CBA that was initially agreed. For sure, we know the national government cannot dictate to the counties on the terms and conditions. And so every facility or every county should deal with their own nurses. So after that, we will head back to Nairobi because we are opening Parliament tomorrow. But we are committed to make sure, one, we look at the facilities that are under national government, but secondly, we also want to urge the counties to offload the burden from these national facilities. The only way that we can have decongest Moi Teaching Referral, decongest Kenyatta Hospital, decongest Mathari, or even decongest Spinal Injury is to make sure that also the facilities at the counties are well equipped, they have medicine, they have enough staff members, so that then we can be able to decongest these national hospitals.
Moi Teaching and Referral Hospital, is is very congested. I mean, maybe the government had released around 11 billion for the construction of the new hospital. Nothing is going on now. Any progress from your side?
Yes, we actually would love not to expand a facility because everybody is going there. Would want to decongest it so that we have primary care. We equip the hospitals from the lowest level. Why should someone leave the hospital that is near them and travel all the way to come to Eldoret for treatment? And so that's why we said our main aim first is decongestion of the hospital.
Okay.
Yes.
Thank you very much, Sam. I'm being told that we really don't have much more time, but there's chairperson for the committee, Mr. Swarup Mishra, Daktari, Vice Chair. What is your take on this nurses strike? What are you doing to ensure that this thing is not repeating itself each and every time?
No, as I told you before, that it is untimely, and every 6 months there is a strike. Uniform should not be a very big criteria to make a strike. Let me tell you, we have to be very, very particular when we are going through about a crisis, economic crisis in our country, because of massive corruption, which President himself hands-on, and try to keep everything streamlined with our other leaders, our other leaderships of the country. Now, that time strike is uncalled for. Let us wait. This is our country, and nurses are not outside. We are all in the government. And then, so I don't support this strike right now. No. For a uniform, yes, uniform, we can give you uniform, but the government can give you uniform. Why money? Yes.
Okay,
yes.
Okay, thank you. Sam, those are the leaders from Committee of Health from the Parliament, and they are here to ensure that they outline some of the issues that are affecting national hospitals, particularly to be specific, that is Moi Teaching and Referral Hospital, which as per now, and as I had confirmed to you earlier, is that it's not on strike and they are not going on strike. And Sam, when Moi Teaching is on strike, being the second largest hospital in the country, is a disaster to the whole Western region. But as for now, things are safe and they are moving on.